Hi, my name is Elisha Khawas. I'm currently a third year nursing student at Swinburne University. I'm here to express my interest in a 2021 graduate nursing program with Alfred Hospital. My preferences for graduate program are cardiac, emergency, rehab, pre-operative and post-operative. I hope to be accepted in Alfred Hospital. This hospital graduate program is important to me because it has 6-month rotation in different sectors, which allows me to get experience of 2 different areas of nursing within my first year nursing career. I have chosen to complex nursing care because this is something I always wanted to do, and this will allow me to provide the best care to the patient. I love to make the difference in my patient's life and give back to the community, and which is what I always wanted and inspired me to become a nurse. And it is one of my reasons which I think I'll be the perfect fit for your organization. Alfred Hospital holds many values that are important to me when it comes to the care of the patients. These are integrity, accountability, collaborations, and knowledge. It aligns with me because these values aligns with my own values as a nurse, and I believe they represent the progress and professionalism in nursing. Collaboration and knowledge are important aspect in every nursing care when it comes to the care of the patient. These values provide a platform for the way nurses work and decisions they make. We, the nurses, have to work collaboratively to achieve the best patient outcome by providing support and holistic care. Although, with this integrity and accountability work together, as accountability is responsible and answerable for action, and integrity is staying true to yourself and to do right thing. Also, I did my mental health and acute placement in Alfred Hospital. It holds great culture and diverse population of staff. Alfred Hospital has developed to provide a supportive environment for consolidation and further future development of knowledge and skills, preparing the new grad nurse for future career opportunities. This will give an opportunity to prepare myself within a year and allow me to expose to the different area of nursing from critical care to the aged care settings. Alfred Hospital is a leader in healthcare delivery and improvement, research and education. They strive to achieve the best possible health outcomes for their patients and their community by integrity and clinical practice with research and education. I am currently working as an enrolled nurse with Blue Cross Aged Care. This role is one of the beneficial roles I pursued in my nursing career. My role as an enrolled nurse directly allows me to deal with the clinical issues, administering the medication, dealing with the challenging behavior patient, providing holistic patient-centered care, and interaction with the aged care residents. Having an opportunity to interact with their family, multidisciplinary team, doctors, nurses, and has allowed me to build respect, support, confidence, communication throughout patients and family. Most importantly, I have developed a good understanding of working as a team to achieve the best goals of a patient. The career aspiration that I aim for after completing my graduate program would be to gain knowledge, skills, and experience in clinical settings and to specialize in a field such as cardiac nursing and trauma. Choosing a specialized nursing career will lead me to clear a roadmap to success. It can also help to increase in specialized knowledge, which can also open doors for me to achieve some of other goals on my preference list. Another career aspiration I will be aiming for is to gain experience in different background patient and provide nursing services in regional areas where there is a lack of comprehensive healthcare facilities. During my clinical placement, I faced a challenge with a patient who had a language barrier. She was a 89 years old female, day 2 post-surgery. She was in a lot of pain crisis but could not able to speak a single word of English and not able to understand anything while I was doing my nursing assessment. My body nurse looking after the patient was busy attending the patient who was in isolation, and she was doing the blood culture, so she couldn't be able to attend the patient on the right time. Therefore, I escalated the problem to the nurse in charge and the nurse in charge, and I was able to use Google Translator to identify her current issue and find out that she was in severe pain. After that, nursing in charge administered PRN analgesia, which helped to manage her pain. From there, I realized language barriers are a key of cause of miscommunications between medical providers and patients, and negatively affect the quality of healthcare services and patient satisfactions. As a nursing student and working myself as an indoor nurse in acute clinical settings and aged care settings, I have some unique strengths which always make me to feel proud myself and bring differences in patients' life. These are working with different sector of healthcare industry and diverse clients and problem-solving abilities. I have dealt with the people that are at the end of their life care, dementia, challenging behavior, and complex care. All the nurses need knowledge and patience where they work. Nurses work with patients, doctors, family, and other stakeholders. As a nurse, my first preference at the start of the shift is to concentrate and receive very good verbal handover from the previous shift nurse and understanding from patient side about the health and well-being as well as their current situation. I often speak to the patient when there are changes on their treatment plans, medication, test, diagnosis, and results. During my placement time, I had a patient once who was recently diagnosed in the early stage of breast cancer. I talked with her about it, listened to her concerns, and by the end of the conversation, she said she felt much empowered to fight this. It was both a humbling and reassuring experience for me. I knew then that this was what I meant to do. My ability to communicate effectively with various people throughout the day during my shift is critical strength for me being a nurse. My second unique strength is problem solving. Nurses should be a good problem solver. There has been days filled with surprises, and a nurse needs to help diffuse stressful situation. My first preference is when there is something changed in patient condition, I put my effort, knowledge, and dedication to solve the problem. My theoretical and practical knowledge gained from Diploma of Nursing till now as a third-year Bachelor of Nursing student has helped and taught me to deal with various challenging problems. There was a situation where I was working as an indoor nurse in an aged care facility during COVID time. One of the non-cardiac patients started having chest pain, and his condition went critical within 5 minutes. I was able to do my nursing assessment and transfer the patient immediately to hospital. Patient ended up having mini stroke and but able to survive. As a nurse, I used my critical thinking and clinical issues to figure out what that could mean for the patient and how to escalate and treat them if needed. The biggest the biggest challenge I might face during my first year of being as a new grad RN would be stress management in a new clinical environment. Transitioning into a new professional role is always a stressful experience with consequences for mental and physical health, job satisfaction, organizational commitment, and turnover. To overcome with this challenge, I will think positive by using communication skills and controlling stressful interactions, also by reducing psychological symptoms of stress with different techniques such as deep breathing, drinking enough water, taking enough rest. Lastly, by practicing new skills, seeking information, asking for help, monitoring and imitating the behavior of experienced colleagues, and contacting peers for relationship buildings. I will also try to avoid stressful situations by developing professional competencies. Thank you for watching and listening to my video. I hope you like it.